Ross Lab statistics, breastfeeding rates have dramatically increased since 1970. As you can see here, in hospital, it's 26.5% of the women breastfed in 1970. At 6 months, it goes down to 5.4%, and then at 12 months, it's an alarming 0%. Well, let's fast forward to 2006. Hospital, 75.5% of the women breastfeed in hospital. After 6 months, it goes down to about 30%, and then 12 months, it's about 19%, which is still really good. So what is the significance about breastfeeding that has increased these numbers so much? Well, the fact is, breastfeeding is the best start you can give your child. And more people are realizing that fact. Any woman that is physically able should breastfeed about 6 months exclusively, and then after that they should supplement with age-appropriate food, but still breastfeed if possible. You may have heard the slogan, breast is best. Well, the fact is, breast milk not only contains nutrition for baby, but also it can help the mom and society. On the other hand, formula or bottle feeding can be harmful, and in order to boost those breastfeeding numbers, we have to be a breastfeeding-friendly society. First of all, people are unaware of the harmful effects of formula or bottle feeding. Several studies have shown that formula-fed children, in comparison with breastfed children, are more susceptible to widespread diseases such as gastroenteritis, colitis, and Crohn's disease. Also, formula-fed children are more likely to be exposed to pathogens, which can contaminate their formula, their bottles, and their other food. Mortality rates in bottle-fed children. According to the Journal of Pediatrics, 27% of infants occur because no breast milk is provided. Now that's in the United States. It says that here it is estimated that 250 to 300 infants die each year from diarrheal infections as a result of bottle feeding, and that's throughout the nation. But that's just diarrheal infections. There's other things that can cause that. Now, something that we may not be aware of is that even if the babies don't have any effects from bottle feeding, adults can suffer also. So if they're bottle fed as children, adults can suffer from allergies, diabetes, hypertension, lymphoma, and colitis, more prevalent than if they were breastfed as children. Now we have talked about the pitfalls of bottle feeding. Let's explore the benefits of breastfeeding. Breast milk is made just for your baby. Human milk is a live substance. According to Marianne Neffert, medical doctor, breast milk contains a special antibody, IgA, enzymes, white blood cells, and other immune support. And according to Amy Spangler, RN, and IBCLC, breastfed babies have less constipation, diarrhea, and UTIs. Milk changes as your baby changes. As we can see here, the first milk, the very end of your pregnancy, colostrum is in place, and that's the first milk at the very beginning of your baby's life also. It's a thick yellow substance, and it's high in protein, low in fat, and rich in antibodies. The antibodies are going to help prevent any kind of disease. Those are your immune support. Second is the transition milk, and the amount of sugar, fat, and calories increase with the transition milk. And then it goes into the mature milk, which most of us associate with breast milk. And there's two different milks there. It's hind milk and foremilk. The foremilk is going to be lower in fat, calories, and protein, and then the hind milk is going to be higher in those things. And it's pretty much distributed throughout the feeding as you go. So let's take a look at formula versus breast milk under a microscope. As you can see here, this is formula. It's very bland. You don't see anything really in it. And then here's breast milk. And you can see all the different colors. It's because it's a live substance. Those are things moving and making your baby healthy, and so it's wonderful over here. You can see breast milk has antibodies, hormones, antiviruses, anti-allergies, anti-parasites, growth factors, enzymes, minerals, vitamins, fat, DHA and ARA, carbohydrates, protein, and water. As you can see, formula only has this little row here. So it's quite a difference. So we know that breastfeeding is good for the baby, but what about the mother? Well, I'm glad you asked, because for mother, according to William Sears, medical doctor, breastfeeding can help reduce risk of breast cancer, ovarian cancer, lessens osteoporosis, helps with child spacing, helps with weight loss after the baby, and it's cost effective. My favorite is the bonding experience. Breastfeeding your child is something that you can never even imagine how it feels. And when you're breastfeeding for your baby, you are their comfort, you are their everything. It's a wonderful experience. But more back to the cost effectiveness of breastfeeding. According to multiple articles, breastfeeding could save parents thousands of dollars. Well, you may be saying, I'm not a parent, this doesn't pertain to me. Well, you would be wrong. Society can save up to $3.6 million a year if women would breastfeed exclusively for 6 months. So we have discussed the downfalls of formula, the benefits of breast milk. Let's talk about how we can boost those breastfeeding numbers. Well, we need to make society a breastfeeding friendly place. So some of the things you can do is you can pass laws. We just passed one in Wisconsin that says anytime that a woman wants to breastfeed in public, you cannot tell her to move, you cannot, ask her to go somewhere else. You cannot interfere with her feeding her baby. So that's one thing. Another thing is talk to your employers. When women go back to work, that is their main concern. Well, I want to continue breastfeeding, but can I? If there is a place to pump or feed the baby, and then is there somewhere they can store that pumped milk? Also support groups. Support groups are lactation consultants, lactation peer counselors, and then comprehensive support is very important in the hospital. Statistics have shown that baby-friendly practices at the hospital increases the likelihood that a woman is going to breastfeed. So I've given you all the information that you need about formula and bottle feeding, the harmful effects of it, the benefits of breast milk, and things we can do to create a more breastfeeding-friendly society. In my experience, I had a child that would not latch on right away, so I pumped for the first 1 month of having her. And the bonding experience wasn't as much as when she latched on. It was a wonderful experience. I also have seen firsthand that she has not been sick, barely at all. So nutritional, wonderful. And this is my breastfed baby right here. I am very passionate about breastfeeding, so much so that I have become a lactation peer counselor. Now it is your turn to go out and make the world a more breastfeeding friendly place. Thank you.
Woohoo!